Hey there. Not just a chiropractor, Stamford, Darien, Norwalk, and New Canaan. Again, I apologize for the lengthy title. Again, the worst title for a podcast, but we're stuck with it now, so we got to live with it. Hopefully, information is pretty spot on and you can benefit from what we have to share. So, today we're going to talk about hip pain. Get a lot of patients complaining of hip pain, and a lot of people choose not to do anything about it. And what I suggest you do is you go to Walmart or all you can eat buffet and watch the living dead wallow around in pain, the way they walk and the way they are destroying that hip joint when it takes is probably a few simple chiropractic adjustments to set that straight. But that'd be a shameless plug for chiropractic, which I happen to be, as you can tell from the title. But let's discuss hip pain. The hip is, first of all, what is hip pain? Well, it hurts in the hip. I got you on that. That's pretty easy. But um, the hip is where you have the femoral head come in contact with the ilium. So it's a stress point because one, if someone's morbidly obese, that can affect it. If you have a number of falls and you don't correct it, your pelvis is going to be misaligned, and that's going to really cause a problem with the state of health of your pelvis. And it's kind of an odd way to say it, the state of health of your pelvis, but your balance is really going to be greatly affected. And a lot of people who have simple hip pain that never get it fixed because the doctor doesn't believe in chiropractic care, or they just rely on steady supply of Advil and Aleve. They are at risk for later on in life serious falls, and that's where it comes into play. Is like, so you have hip pain becomes chronic. You don't treat it, it gets worse. Take some Advil, say leave. God forbid if you knew what that does to your kidneys and your livers, but that's a whole other area we won't get into today. So you do not get it fixed, and you just you start to develop these walks of the living dead. If you see night that show, whatever, the living dead, that's how these people walk eventually, and eventually that hip is gonna crack. And if it doesn't crack, it's gonna put you at such a serious risk for falling. You have no idea what you're up against. What happens is, first of all, I say a good chiropractor is going to assess your hip, put it back into place, and let you function at a better level. If your hip is out of place, the pelvic, the ilium is, so let's go over it. Let's backtrack a little bit. You have two ilium and sacrum. That's basically your hip. Now, what we think of the hip is where the femoral head comes into the socket. That would be called the hip joint. Okay, so the femoral head and the ilia make up the hip joint. And for the most part, if those are balanced properly, you can support the lower back. And you're also, by the way, going to have a lot less back pain because a lot of back pain comes about from faulty pelvic, not design, but the pelvis is not functioning optimally. And what happens is people just wear out the disc eventually that separates the two bones, the bones in the lower part of your back. And that, if you hear it, someone's got a herniated disc, a bulging disc stenosis, I would say the majority of the time, the real brunt cause of it is going to be pelvic misalignments. And so if you address these pelvic misalignments, one, you're going to have a lot less pain. Voila, that's a good thing. Two, you're going to have a lot less back pain as well. And since 4 out of 5 people are going to have a back problem at some point in their life, and a lot of those back problems as a result are a result of faulty pelvic structures. So, you want to avoid a hip replacement? See a chiropractor early on. Don't let it get worse. Now, if you have a hip fracture, then you got to go to a physical therapist because chiropractic is a fractured bone. We're not going to fix that, but you would benefit from actually more of a combination of chiropractic care with physical therapy, and it's not a bad way to look at problems because solving that problem is going to make you feel a lot better quicker than if you just address you know one or the other, physical therapy or chiropractic. And I think that's a miscommunication from the medical doctor's profession to the patient. I want you to hear you have hip pain, take this pill. That doesn't work. Well, you go out and you get you get something else, or you go to physical therapy. God forbid you go to a chiropractor. Medical doctors, if they can't give a pill or physical therapy or surgery, but mechanically, your structure needs to function optimally. When it doesn't, you need to see a chiropractor, get it restored, and you'll have a lot less problems and a lot less pain. Now, Advil and Aleve can go a long way to mitigating pain in the short run. It's not going to put a bone back into place. That's the chiropractor's job. So, if there's any takeaway, what I'm going to suggest you do is you have hip pain, go see a chiropractor. It'll make your life that much better, that much quicker. Now, again, self serving since I'm a chiropractor, but that's what we do for a living. Hopefully, you benefit from it. But understand chronic hip pain can lead to serious falls, which can lead to nursing home stays. Nursing home stays can lead to permanent sayonara. Also, hip replacement is another thing with a serious fall. So it's a chain of events that can be prevented if you take the right steps early on. So it's really easy for me to say because I am a chiropractor. Go see a chiropractor when you got hip pain. I'm Dr. Brian McKay, Core Health in Darien, and stay out of trouble and have a good pain-free life, especially when you go see your chiropractor on a regular basis. Thanks very much for listening.